York Times reported that several years after President Bill Clinton's, quote, failed effort to remake health care in America, the health care market is remaking itself, end of quote. Some outstanding breakthroughs are happening in the field of medicine for those who can afford them. One day soon, perhaps, you will be able to take a routine urine or saliva test that can warn of cancer and the very expensive chemical and surgical treatments that follow. Money in our conventional treatment system gets you the best service it has to offer, if, of course, you have the money. Prices for the 50 drugs most frequently used by older Americans increased last year at nearly twice the rate of inflation. But a maverick researcher, not even a medical doctor, mind you, has attacked what she calls a money pyramid of drugs and surgery as a symptom chaser at best. She claims that, for example, cures for cancer, AIDS, and just about everything else can be achieved with 3 common herbs and an invention of hers that she calls a zapper. If true, that would be wonderful news to the 44 million Americans without a health care plan, the millions of Americans who can hardly afford one, and the entire population of Africa that is being decimated each year by an immune deficiency caused by malnutrition, poor hygiene, and no medicine. Conventional medicine calls it AIDS, which, by the way, Dr. Hulda Clark says she can cure. To say that Hulda Clark, a PhD in cell biology and research, is an out-of-the-box thinker is putting it mildly. And this 71-year-old author of several controversial books is paying for her ideas. On September 20, 1999, she was arrested in San Diego and transported to Brown County, Indiana, where she had been charged with practicing medicine without a license. In April 2000, these charges were dismissed. All disease, she says, is caused by only 2 things: pollutants in the environment, especially in food, packaged goods, and the home itself, including pets, and parasites in the body. And the cure, she says, is a combination of using vitamins and herbs in combination with electricity to kill bacteria, viruses, and parasites in minutes, not days, as antibiotics require.
That was negative. I'll do it again.
She has even invented a device she calls a synchrometer as a testing device to spot the pollutants and parasites. She's a quack, a fraud. She's out to separate the desperate and the lame of mind from their money. Her theories don't stand up to scientific scrutiny, and her critics want you to know that she is not a graduate of a medical school. Those who hate her ideas seem to hate her. On the other hand, her following, both among medical doctors and people who claim they have used her method for cures from cancer and other fatal diseases, and those who buy her books, believe her theories, and seem to love her even more for them. I will present Hulda Clark in a series of programs that will give you the opportunity to evaluate what she believes and her methods, including her highly controversial devices, the synchrometer, and the zapper. Does she represent the future of medicine, or is this quackery? We believe that an informed public can choose what it believes is the best way to be treated for physical illness. Because neither I nor anyone appearing on this program is trained in medical science, no statements or beliefs should be construed as medical advice. Consult your licensed medical practitioner for that. Much of the information presented on this program has not been scientifically proven and is theoretical, although it is believed to be true. Many, if not most, mainstream medical professionals will not agree with the views expressed. No claim is made on this program of any cure, and the guest is not a medical professional. Pregnant women and people wearing a pacemaker must never use the experimental electrical system used in the demonstrations on this program. Whatever data you receive is theoretical and is offered for informational purposes only. The theories result from personal research. You're also advised not to use any device you see on this program without expert assistance, and to take precautions against electrical shock or damage to your body. In some cases, death could result from the use of the electrical experimental device seen on this program or the failure to follow these guidelines. You must assume all risk if you use this information. I'm Tony Brown. In a moment, self-health, cutting-edge science, or quackery. We know that there is a great controversy about your theories, and we know that, at least I have found out in my research, that you have a tremendous number of supporters, and you also have a tremendous number of detractors or critics who say that your theories don't hold up and so forth. So over the period of the next few programs, I want to explore it. The reason we're doing more than one program with you is because it's such a complex subject and there's so many facets. I think it would be unfair to you and to the audience to attempt to try to examine the entire spectrum in one 30-minute sitting. So tell me what your theory is in terms of disease and how you recommend that disease is treated.
I generalized because I saw so many diseases that I was working on to be due to a parasite and a toxin in combination, kind of a collusion between them maybe, that I generalized and said all diseases are due to a combination of some parasite or something that's trying to live on you, even if it's a bacterium, that's really a parasite in a sense, and a toxin, maybe a solvent, maybe a heavy metal that's facilitating that invader.
Give me an example of a disease and an example of the parasite and the pollutant and how they work together to create that disease.
Well, the easiest example that comes to mind is diabetes. You have the pancreatic fluke invading the pancreas and probably the islets of Langerhans, which are inside, and pollutant wood alcohol, methyl alcohol, wood alcohol, which pollutes nearly all the processed food that we have on the market in tiny amounts, but by the time you're drinking and eating it all day long with that little bit, it adds up. And that combination I always see in diabetes. That might not be all there is to it, but if you correct those two things, you recover from your diabetes.
The 71-year-old scientist and grandmother is the author of several controversial books: The Cure for All Diseases, The Cure for HIV/AIDS, The Cure for All Cancers, and The Cure for All Advanced Cancers. Dr. Clark designed the synchrometer to locate and identify toxins, parasites, viruses, and bacteria, and she created the zapper to kill them.
Here is a synchrometer, which is a circuit together with this resonance box, which can analyze your tissues without going into you to see what is there. This part of this is the circuit, and it is just a one transistor oscillator. It's a very simple little circuit that you see in many other larger circuits, but it is so simple that I would like people to be able to make this, and that's why I have the instructions for it in the books. The resonance box is attached to it. This is where you put your samples. You would put a sample of your body on one plate and a sample of the item you're testing for on the other plate, and I'm going to show you what it can do. Here are some locations in a person's body. They are called slides. Okay, they're samples of a tissue. This one is tooth. This one is lung, and so on. All the different tissues have samples made of them. You can purchase them. They're perfectly safe to use, and that way you can search in a person's body for whatever toxin or solvent or bacterium or virus or whatever, or parasite, whatever you want to search for. These are the test substances. Toluene is a terrible solvent that goes to the brain. Thallium is a terrible solvent, goes to the nervous system too. Here's an azo dye, Sudan black, another azo dye, fast green, found on all your produce. That's sprayed, which is nearly everything. Dab, another azo dye that pollutes our food, our produce. And the others might be heavy metals. Here's nickel. Here's methylmalonic acid, which causes kidney disease. Here's isopropyl alcohol, which goes with the big parasite Fasciolopsis buskii. And this is taken from a huge animal, so don't think that this is what you have in you. But that's where the slide, how the slide was made, from a large animal. Ours are much smaller, and they can be as baby size, of course, as small as an egg when it first hatches out. And this is the adult, though, of that. And that, together with this solvent, causes a growth factor to be made called orthophosphotyrosine. And I'll be testing for that. Here it's gold, which goes to the pancreas and also causes obesity. Here's DNA, which is in overabundance when you have a tumor growing. So by testing for this, you can tell if you have too much of it. Benzene, which we find in all AIDS cases, and in people with terrible sensitivity to all their foods and the environment. They can hardly stand to live in their own homes with benzene too, and no longer able to detoxify it. And acrylic acid comes from plastic teeth. It seeps out of plastic teeth when they aren't hard enough and turns into malonic acid, and from there to methylmalonate. So I would like to show you this kind of testing, which is more powerful than an MRI, I think, or a CAT scan, or even an X-ray, even though it doesn't draw a picture. What's best is having both. Now you can do make a chemical picture.
A chemical picture?
Yes.
One of your critics said that what you're proposing is preposterous because this is too cheap. He said the only way you can have good health is, and I mean, I'm almost quoting him as a medical doctor. He said the only way we can have quality health is to have expensive health.
And I would change that around to say that the only way we could have quality health is to enable every person for themselves to have such a device so that they could go to the marketplace, figure out which produce has these azo dyes, which does not, which part of the salad bar has salmonella in it and which does not, so that the consumer can make a healthy choice.
Michael McElray is a nutritional consultant and a personal trainer.
What Dr. Clark said, and what she's already talked about, is that parasite and pollution is basically causing disease. And when we say parasite, what we're really talking about is microorganism. That could begin with something as small as a virus. And what I like to talk about here, to give you an idea of what we're really looking at, is the monkey in the barrel concept, where the virus is inside the bacteria. The bacteria is inside the parasite. And in fact, we've even found that mold is inside the parasite, and certain funguses are inside the parasite. So the parasite becomes a train, if you will, carrying all of these other microorganisms into the body. And this isn't something new, and this isn't just theory. This has all been proven. What's really interesting is how these parasites and different microorganisms found their way into the body. And what Dr. Clark has proven is that the immune system over the last few years has been depressed. And it's been depressed, number one, because of over-the-counter medications being taken too much. And I'll give you an example. The hydrochloric acid in the stomach has been specifically given to us as a gift. And that gift is to kill microorganisms, including salmonella, which we could get from mishandling eggs and butter and dairy products, and Shigella as well, which are bacteria. E. coli, which we've heard about outbreaks from people not properly washing after they go to the bathroom, and some of the farmers in the south and on the west coast, where there aren't porta potties in the middle of the strawberry fields, actually go to the bathroom right on the berries. And if people aren't washing their fruit, they're asking for big trouble. Well, even if they are washing their fruit, if we don't have stomach acid that could kill these harmful bacteria, then these things will crawl through the body and take over the biological terrain at will. What Dr. Clark's proven is that these parasites that normally are killed by the stomach acid are now crawling through the body because we went down to the local drugstore and we picked up the Alka-Seltzer because we were suffering from acid indigestion. What was that? Well, what it was is we were eating food that properly couldn't be digested. And we were eating too much food that's deficient in enzyme. And I'm not talking about theory here. I'm talking about practical ideas that have already been proven. When we overcook food, we kill the enzymes. When we kill the enzymes, we ask our stomach acid to do the job for us. In doing that and over-processing our food, we've reduced our stomach acid to a level now that she's found with certain patients, like cancer patients, there isn't any stomach acid at all. Hydrochloric acid is our first level of defense, which is now missing. The second level of defense, which seems to be more frightening, is that once the parasites are inside the body, the liver has been given the capability to as a second shot to kill these microorganisms. Now, when the liver accumulates aflatoxin, which she has identified as patulin mold, which we find on many fruits, especially grapes and apples and pears, and it's the brown spot that we see in the fruit, then what we see is the liver gets chronically weak. And at that point, what she discovered using her syncrometer, which we'll talk about, she's actually found that the weakness caused by the aflatoxin and the patulin mold has actually allowed certain other chemicals to weaken the liver even further, including alcohol. Believe it or not, people that don't drink alcohol still have alcohol in their body because alcohol is a natural byproduct of the fermentation of fruit. So if you're eating a tremendous amount of rotten fruit, which you may not know because your banana just had a brown spot, or your apple or your pear had a brown spot, and you might not have even seen it. You ate your actual mold and your fungus. Once that's in the liver, it loves a dark, cold place. And 98.6 degrees is fairly cold for mold. It'll grow like a petri dish in your liver. Once it starts to grow and alcohol becomes a byproduct, we now have a depressed immune system in the liver. Parasites can now take over your biological terrain. And what we used to think, and what Dr. Clark has now proven, is that parasites used to live only in the colon, according to many scientists and researchers. Well, what she's now discovered is that these parasites are crawling through the body at will. And this is a very frightening thought, because if parasites, their eggs and larvae, are crawling through the body, then they're also seeking out tissues that are extremely nutritious to them, which is the brain, which is the heart, which is the liver, and other body parts, that once these body parts are invaded by parasites, other diseases will follow, as you've pointed out. And Dr. Clark found that the one real dangerous parasite is the Fasciolopsis buski. What's most interesting about the Fasciolopsis, which I have a slide of here, which I'll show the audience, it's a fairly large parasite, and it's actually hosted in the snail. And up until recently, people thought that that particular parasite was hosted in the snail in China. Any research that you look up in the library says that the Fasciolopsis buski is found in snails in China. What Dr. Clark did is she sent around the world for samples of snails. She then took the snail and she found a specific chemical toxin in the snail called orthophosphotyrosine. Every time she found the presence of orthophosphotyrosine, she found the Fasciolopsis buski in the snail, or its larva or egg stages. What was most interesting is that she found the Fasciolopsis buski in the snails that she brought in from Alaska, from northern Ontario in Canada, from Colorado, from California, from New York. Guess what? The snail is everywhere on the planet. It's crawling on your garden. It's crawling up the side of your house. And that friendly little snail is carrying the Fasciolopsis buski in all of its stages inside of its body, which is really harmless when you look at the big picture, until the cow eats the snail or its stages off the grass, and then the Fasciolopsis is now in the cow, and when we drink the milk or we eat the beef or the pig or the sheep, we're actually eating the parasite stages. And to make it a little bit more dangerous, when you start spraying your lawn with sheep manure or cow manure, or you start using these types of manures in organic gardens, you now have a second problem. You're actually putting animal feces on your food, and we're eating it. Because there's no way, Tony, to properly wash all of our food to the extent that we really need to. Now, up until the last few years, we've been able to depend on our stomach acid to kill this parasite. But now with the addition of isopropyl alcohol, which Dr. Clark has proven can accumulate in the liver if the aflatoxin in the mold is there, the Fasciolopsis is now able to hatch in the liver and then run through the body at will and seek out a tumor site, and at that point it will have a metabolic byproduct that she's found to be orthophosphotyrosine. And when that's present, 100% of the time with her experiments, she's found the malignancy of cancer also to be present.
What foods have parasitic contents that you would find adverse to us that would create these diseases?
Nearly everything. Nearly all the produce has dirt on it. How could it be otherwise? It was grown in the soil. And you can't sterilize them. So the dirt that's on them has parasite eggs and, well, eggs primarily, on it. All different kinds. Roundworms, flatworms, anything you can think of that lives in dirt or is spread through dirt, namely has had animal leftovers in it, is on the food. It's cleaner than if you had just pulled it up, of course. They do wash it, I think, before it leaves the farm or the big gardens, but it has it on it. And the dairy, all the dairy products have parasite eggs and stages in them.
Now, one of your theories is that we get certain contaminants in bottled water, for example.
Yes.
Not because the water is not pure, but because the chemicals used to clean the machines. Would you explain that?
Yeah, one of the chemicals allowed for these things is isopropyl alcohol. Your bins and vats and mixing dishes and everything has to, by law, and we do need it sterile, you know, be cleaned with something that sterilizes it. I'm not against sterilizing anything. We need it sterilized. But when you use chemicals and are required to leave the bins wet, that's a legal requirement. You may not rinse it out.
You would prefer the public to drink tap water?
Yes, from the cold side, of course, because that hasn't gone through your heating system. But it is by far the better water.
Are the chemicals in the municipal water?
Yes, there are, but the levels are pretty low. And it is far better than drinking solvents. In bottled water, you must drink traces of whatever was used to sterilize that bottle and the machinery to pump it all. And that is often a solvent.
With regard to what we eat, you're proposing a pretty draconian adjustment in life, and that is in order to look at pollutants. And normally when we say the environment or pollution, we think of the sky, we think of the air. You really are talking about the elements in our environment, our furniture, the things that we use to clean our homes with, detergents. You're talking about the clothes we wear, the dry cleaning, and you're talking about things as simple as getting your hair colored or tinted.
It would be pretty easy to take those special toxic things out, and I'm hoping that that's what will happen. It's just that we have an inertia about us, at least commercially. The manufacturers have an inertia about them not wanting to change. But you wouldn't be changing to a draconian lifestyle. You can have nearly everything that's out there if it would just be cleaned up. You see, they did ban azo dyes in food products decades ago, but I find traces of azo dyes in our foods, nearly all our processed foods. By nearly all, I mean about 95% of everything I test, and I test probably 10 to 50 items a day, which turns into thousands. You know, nearly everything is polluted with azo dyes, and I did pursue that. I was shocked with that. We did check with the FDA, some personnel there, who gave me quite an education that nobody is testing for azo dyes in foods because they are illegal.
Well, why would a manufacturer run that risk if they are illegal?
They aren't being put there. They get in as a pollutant. The body, the liver, has to mobilize its special systems of detoxification, which were only meant to be used occasionally. Now you have to, we're like alcoholics. alcohol uses a special system of detoxification. Now we're using so many products and odd foods and artificial foods that the liver has to detoxify. I think that's it, but that's just a theory. That isn't something that I've observed. That is a theory of mine, that that's why the liver is behaving so poorly, that my grandchildren have to be treated very carefully with respect to everything that's cooked for them, and still they hardly eat.
On the next part of this series on Dr. Hulda Clark, self-health, killing the parasites and cleansing the body.
Tony Brown Productions produces this program and is solely responsible for its content.
Even before the first part of this series on Hulda Clark's self-health theories was aired, a campaign to stop it and subsequent programs on her was announced on the internet. Around the same time, her supporters were networking and enthusiastic about her rare TV appearance. Some of them even claimed cures. Dr. Clark is a PhD in cellular biology and a naturopath. At the conclusion of this series, I will give some of those who disagree with her the opportunity to refute her claims. After questioning my journalistic credentials and more, one of her detractors asked rhetorically, quote, "Does Tony Brown really believe gizmos powered by a small battery can cure the world of illness?" Close quote. Actually, Hulda Clark says that her zapper, as she calls it, is a parasite-killing machine with a frequency of about 30 kilohertz. An ordinary battery provides the positive voltage. For the diagnosis of these parasites and pollutants, she uses a device called a synchrometer. It is described as a, quote, audio oscillator which utilizes the capacitance and inductance properties of an external circuit so that its resonant frequency is the same as the emitted frequency coming from elsewhere, such as that given off by microorganisms. The circuit will then oscillate from positive feedback in an amplifier circuit. Its oscillations can be heard in the same way a public address system squeals when feedback gets emitted, close quote. The zapper and the synchrometer are her two main gizmos, as her critic calls these devices. Part 2 of her therapy program is to eliminate any remaining parasites with herbal remedies, especially through the use of a combination of black walnut green hull, wormwood leaves, and common cloves. Does her therapy program work? I have no idea. You can evaluate for yourself the truthfulness of Hulda Clark's claims and theories. She believes that the source of all disease is a combination of parasites, bacteria, viruses, and pollutants in the body. On this program, Dr. Clark discusses her methods of finding and ridding the body of these substances. Because neither I nor anyone appearing on this program is trained in medical science, no statements or beliefs should be construed as medical advice. Consult your licensed medical practitioner for that. Much of the information presented on this program has not been scientifically proven and is theoretical, although it is believed to be true. Many, if not most, mainstream medical professionals will not agree with the views expressed. No claim is made on this program of any cure, and the guest is not a medical professional. Pregnant women and people wearing a pacemaker must never use the experimental electrical system used in the demonstrations on this program. Whatever data you receive is theoretical and is offered for informational purposes only. The theories result from personal research. You're also advised not to use any device you see on this program without expert assistance, and to take precautions against electrical shock or damage to your body. In some cases, death could result from the use of the electrical experimental device seen on this program or the failure to follow these guidelines. You must assume all risk if you use this information. I'm Tony Brown. In a moment, self-health, killing the parasites and cleansing the body.
I am testing myself as well as doing a control for the test that I'm about to do. Identical. Positive. So there's something on this plate that is identical with something on this plate. I don't think there's any other instrument ever invented that could do that. It makes it very powerful to be able to detect things, whether they're bacteria or viruses or toxic substance or your metabolites. You can search your metabolism, and that's been fascinating to see how your body works, how a virus, for instance, is incorporated. What happens to the HIV virus or herpes virus or other viruses that we eat or get somehow. We know how to kill them, but are they really gone? So we can put your chromosomes, a sample of chromosomes on one plate and a sample of the virus here, and see whether it really isn't gone, whether it's still hiding in your chromosomes. And we call that a latent virus, like herpes. In other words, we know, we've been taught that, and you know from experience, that once you have herpes, you always have herpes. It doesn't go away. As soon as you trigger it, it comes out. But we can detect which chromosome that herpes virus is in.
Hulda Clark, an author of several books, designed the controversial syncrometer to locate and identify toxins, parasites, viruses, and bacteria, the sources, she claims, of all disease. Is there any danger to her from that circuit going through her body?
No, I've never seen any side effect. Of course, the voltage is very small. It's about maybe, there's a 9-volt battery in here. What's coming out is about 4.5 to 6 volts. And that's all we need to pick up on the internal organs of her body.
It would seem that your theory is the antithesis of traditional medical practice. Why are you not critical of medical doctors?
They are doing their best. They are scientists in their training. They can't apply their science. The system isn't made, they have to fit into their system, and it isn't made so that they can apply their scientific training. They have to go by the protocols already in place for them, and they have to abide by that or lose their licenses or somehow no longer be in that profession.
How does the traditional practice of medicine differ from what you do?
As night and day. I would look at a blood test and I immediately can see that here is a slightly high BUN, blood urinary urea, blood nitrogen urea. And that lets me know that there's a high level of bacteria in that person. Yet a clinician would look at that and say, oh, it's not important yet. It's not over the top. It's not out of range at the high side. Yet I know that we have to go after some bacterial invasion. Now, there may be an especially diligent doctor who thinks that since it's near the top, you should go after it, and they have been trained to think that such a BUN value represents failing kidneys. So they would go after kidney support. Whereas my syncrometer data has shown me that it is not a kidney problem, that it's a bacterial invasion problem. And it's very easy to find which bacteria they are. You solve it in less than a week.
Are you saying that your orientation is cure and the medical profession's orientation is treatment of symptoms? Is that correct?
Yes, I do. I think that is the correct distinction. Because if you are finding the real underlying causes of some illness or lack of wellness, then I think you're on the road to finding the cure. That it's a process difference. If you are looking for something that makes you feel better, makes the symptoms go away, you are looking for a treatment.
Now, this is at the heart of where your critics are. We're going to talk later extensively about your approach to cancer in particular and to what we call AIDS in particular. But they say that the people who leave you, that you call cured, aren't cured because you don't see them again. Whereas in conventional medicine, they have a 5-year window. And if there's a recurrence within 5 years, they don't call it a cure.
Well, take an example. Supposing there was a whole bunch of little red bumps, itchy bumps, say around your ankles and around your waist, and you gave some kind of a lotion that instantly made them disappear. It would be maybe a treatment, but supposing you found a cause and effect, like I would, and that made them disappear. And the person turned out to be flea bites. Okay, say, I found it was flea bites. They didn't find what it was, but they got rid of the symptoms.
I have a, hypothetically, I have a benign tumor. Bottom line, we should or should not be concerned about a benign tumor.
We should be very concerned.
Why?
Because it tells us that we now have a dozen things in us that enables us to make tumors. And that one little one that we first see gives us that information. It's the warning bell.
And at that stage, we should begin to do what?
Clean up.
Clean up what? Our bodies?
Get those dozen things that I find in all tumors out of us.
How do we do that?
You kill parasites because several parasites are involved. You get rid of all the dye, colored food, colored beverages, and colored hair dye. Okay, you get rid of that. You stop eating asbestos.
Stop eating asbestos?
Eating asbestos. It's a much more important thing than stopping to breathe it. We're eating it in all our produce. And we have to learn how to wash it off. It's pretty easy, but you have to do it. You have to stop having magnetic metals in your mouth. Stop sucking on metal in your mouth.
Michael McElray is a nutritional consultant and a personal trainer.
And Dr. Clark has basically taken food product and said to people that there's an opportunity for us to heal ourselves because the body is an incredible self-healing machine if it's given back its immunity. So all she really does is encourages the body to heal itself. The actual mechanism that the body uses to heal itself still really isn't understood, and it may never be understood because it's a great gift from God. What we do know is that there is specific ways of regaining the immunity by killing the pathogens and by also removing the toxic solvents, and that's what she's discovered, is how to do that. And I'll just go through quickly here and show you how she does that. The first thing that we need to understand is how the toxins got into our body. So I want to point out that the teeth become an interesting part of that equation because tooth metals for a number of years have been put into our mouths as a way to protect the tooth and prolong its life. But what we're now starting to understand, and this is being proven all over the country, and I believe that it's not being brought to the public because of the fear of the massive amount of lawsuits that the American Dental Association could face, but the tooth metals are full of very toxic substances known to man, including mercury, including cadmium and vanadium, all things that Dr. Clark has found inside the tumors. So I've given an example here of tooth metals that are very toxic, and these teeth have been extracted from a patient that had cancer. Now, you can replace the teeth fillings with a product now that Dr. Rhoda is using, he's a former professor at UCLA, and he's using a product called Diamond Crown in the tooth itself, and if it's a fairly large filling, he's using methyl macrolate. And he's using the blue laser to harden it. And Dr. Clark has proven that if the material is hardened enough, then it won't leak into the body and you won't be able to get these toxins. Another fear is that under these fillings, because they're not airtight, they allow bacteria to colonize. And the specific bacteria that she's found in the tumors, which is actually causing the tumors to form, and it actually creates its own DNA, is a bacteria called Clostridium. And any of the dentists are very aware of this, and so are a lot of the research scientists. I'll just hold that up for the camera to see. You really won't see the bacteria, you're just seeing more the name, but that's a particular slide of it. It's so small that you would need a very powerful microscope to see it until it turns into a tumor, and then you can see it with the naked eye without any problem. But when the Clostridium is starting to form by leaking out of our teeth, it will find the area of the body that's been weakened by the specific toxin and the parasite that's accumulated there. And this has been a tragedy since the beginning of our medical understanding, because dentistry and the AMA, the American Medical Association, have always run separate businesses. Dr. Clark has proven that these two businesses need to come together, and people that see their dentist should immediately go after practitioner to make sure that whatever has happened with their dentistry hasn't also leaked into their body. She's discovered that specific metals in the teeth have accumulated in the heart, causing heart disease. Specific metals in the teeth have accumulated in certain tumors, causing cancer. And she's also proven that these same metals have accumulated in the brain, causing Parkinson's and MS. Now, once those metals that you see in these specific teeth here have accumulated in the body, how they get there is most interesting. Because they're an amalgam, it was thought that if they were all glued together into the tooth that they wouldn't leak. But the saliva in our mouth is so high in enzymes, it's able to erode the tooth because we're sucking on it day and night, and just micro amounts of toxic chemicals like mercury will literally go into the body and crush the immune system, and at that point microorganisms will crawl in at will.
Now, why should we get the mercury out of our mouths?
There's a very big contribution of metal, toxic metal, to cancer, tumor growth. And with such a bad association to metal, it seems to me just obvious that we shouldn't be sucking on it all day, which is what we do to our tooth filling.
If I want to take all the metal out of my mouth, whatever it is, it's very dangerous, according to your books, that I go to a dentist who's just going to pull my teeth. And then would not all this toxic, based on what you say, that's in the metal, then just overwhelm my system?
No. I have a little section in the book called Dental Aftercare. And it's a homemade kind of treatment where you use hot water packs and so on to heal your mouth, and you do not have a problem with removing it. But none of the metal things that we put in our teeth, for instance, are at all pure. They are terribly polluted. It would be impossible commercially to produce pure metal. Yet, what metal is polluted with, if you can call it pollution, is magnetic elements. There's a whole bunch of them, about 15 magnetic elements, and they are the ones that are lowering our immunity together with asbestos. So those are very important things, the most important things that a person who has a small benign tumor somewhere needs to do.
Well, how would you recommend that we clean our bodies? In other words, if we have a warning sign or we don't have a warning sign, we just want to practice self-health. We want to have good health. What do we do? You have a liver kidney cleanse program, do you not?
You do this ancient treatment whereby you cause the liver to push out what is in the bile ducts. And it should, of course, be bile, but often it's such poor bile it isn't even green. And it's full of crystals, cholesterol crystals. It's an easy way to get rid of a lot of cholesterol.
Gallstones?
Yes, that too. They're not the kind of stone that you might get out of the gallbladder when you've had surgery for stones. They look different and are calcified.
Now, let's go back to the cleansing. We want to cleanse our kidney and we want to cleanse our liver.
Yes, but it is better to do a kidney cleansing first, because when your kidneys are in good shape and you've increased your water consumption to help them along, then the liver cleanse, which gives you a gush of all this terribly foul and toxic material from the bile ducts, won't affect your body so much. See, what you pull out of the liver, this very toxic stuff, can spread into your bodies. Out come bacteria and viruses too. And if you have a good elimination system, especially the kidneys, then you never have a problem with it. You don't feel sick.
Now, the liver is the organ that really discharges the toxins and the poisons from our body. So therefore, if the liver is not working, we're in real serious trouble.
Yes.
Now, what are your steps? What do we use?
For the kidney cleanse, I picked about a half a dozen of herbs that are easily available. You can order them easily, that are known already back to antiquity to help the kidney. Some of them dissolve kidney stones, not all of them. And some of them relieve pain in the kidney. Some are diuretic, which is good for you.
That makes you discharge
yes,
liquids from your body.
Yes, and you're supposed to drink a lot with it, and you have, in a way, cleaned up your filtering system, which is your kidney. And you know, say for a car filter, once it's clogged, it doesn't work very well, and you have to get a new one.
Well, now you're real high on black-green walnut hulls. That's a herb.
Yes.
And in combination with two other herbs, what are they?
Cloves and wormwood.
Those three.
Yes.
Would you repeat them for me, please?
They're the green hull of the black walnut tree nut, and the cloves, just the same as you cook or bake with, and wormwood, which is an ancient anti-parasite treatment. Those three.
Now, I did some research, I've done a lot of research, and it verifies that there is research, a body of research, as to the scientific usefulness of those three herbs. That doesn't mean that in combination they're going to do what you say, but there is some scientific history for those three herbs. What do those three in combination do to the body, for the body?
It kills parasites, nearly all the parasites that I ever tested for, which was around 80 or 90 different parasites it kills. It does not kill toxoplasma because it's intracellular. It does not kill candida because that gets to be intracellular.
For those who don't know, that's
right.
Yeast overgrowth.
Right.
Women in particular.
There are a number of things it does not kill, but when it can kill nearly all of the common parasites that are, you know, have a fleshy body to them that we find so loathsome, that's what it does.
Do you make the claim that using those three herbs in combination cures cancer?
No, I don't. I say that those three herbs in combination plus an electrical treatment is the right cure of a malignancy.
Well, it was proved at the turn of the century that the human body is almost 80%, 90% water, and it's also got electrolytes in it, which we know to be salt, potassium, different minerals. That means we're a salt battery. No different than the car battery, different than something like that. And there's a patent actually called the Cali patent, which I'll hold up here for the camera to see. And this patent actually was developed in 1897, and not much has been done with it because at that time everyone was afraid of electricity. Well, today what we know is microcurrents of electricity won't hurt anybody, and they use it in the field for the cows to stay in the pasture, and it's been used in the TENS unit for people to get well if they've had muscle injuries. In this case, Dr. Clark developed a product using a 9-volt battery. And I'll just show you in the back here. There it is, 9-volt battery. And this particular unit, you just snap on your wrist with 2 wristbands.
We only have a minute. Yeah.
You snap it on your wrist just to prove that I'm a circuit. I push the little green light, and the thing is on. And if I put my hands together, you can hear that I'm a circuit, and I'm a closed circuit at this point. Now with
Why do we get a sound when you put your hands together?
Because I've closed the circuit. Now when I take my hands apart, obviously the electricity is now being able to flow through the body. The electricity can't go through the digestive tract, so in the digestive tract, to kill the microorganisms, the specific parasites, she's found the effectiveness of the black walnut, which the native Indians used for cleansing many years ago. The black walnut, in its green hull form, kills many of the microorganisms, and in conjunction with another product called wormwood and cloves, typical cloves that you would get at the store. These three in combination have the ability to go in and kill all the pathogens. Now, what's most interesting is the Mexican people have the lowest incidence of cancer anywhere on the planet. And the reason is they kill the ascaris with this particular product here, we all know to be the jalapeno pepper. And those seeds of the jalapeno pepper, only 10 or 15 seeds twice a day, have the ability to kill the ascaris, which she found to be a major cause of why the body loses oxygen at the tumor sites. And to kill that, you use the jalapeno seeds, and then you back that up with a little ozonated olive oil.
How are you so certain that each time you have cured the person?
We use scanning techniques and we do blood tests. You can tell if a tumor has shrunk or not. It isn't that difficult to see if the blood test improved or not. But I realized this kind of criticism would come along, and that's why I saved 50 sets of x-rays before and after and all the blood tests, and that's what I published in the last book.
Now, this is where you really go head on with your critics, because when you use the word cure cancer,
I mean, eliminate the cause.
Some of them go ballistic. I've got a ton of things here from the internet,
yes.
And they say that's just crazy. They call you bad names. They say it's not good medicine. It's bad information for the public.
It's not good medicine, that's certainly true, but it is good cause and effect, a pursuit of cause and effect.
Next week, Hulda Clark will offer her theories and examine the first 5 leading causes of death in the United States. She will share her research into the relationship between parasites, bacteria, metal, and pollutants in heart disease, cancer, stroke, lung disease, and diabetes.
Tony Brown Productions produces this program and is solely responsible for its content.
Dr. Hulda Clark is a cellular biologist who states in one of her books that, quote, the sick have been held hostage for their money or intangible assets since time immemorial, end quote. She states that the treatments outlined in her book, quote, are not intended to be a replacement or substitute for other forms of conventional medical treatment. She suggests that the reader consult with their physician or other health care provider. Instead of drugs and surgery used by conventional medicine, she recommends herbal nutrient support, especially a black walnut wormwood combination, to eliminate parasites and bacteria from the body, along with pollutants in food and other products. That, she says, are the causes of all diseases. But it is Hulda Clark's use of electricity as a therapy that sets off alarm bells among her critics and enemies. She states, quote, the most promising discovery in this book is the effectiveness of electricity to kill viruses, bacteria, and parasites. Does this mean you can cancel your appointment with your clinical doctor? No, it does not. Killing your invaders does not make you well instantly, but happily at your next doctor visit, she or he will be removing drugs, not adding them, end of quote. She reminds us that she did not patent her electrical invention, which she calls the zapper, so that anyone who wants to build one can do so. What she calls a zapper is a simple 555 timer circuit powered by a 9-volt battery. She even gives instructions for zapper construction in a shoebox, using about $25 worth of parts. However, the schematic in her book is drawn incorrectly, with the battery upside down and one of the capacitors showing the wrong value. But it is precisely her charity that worries her detractors. They believe the zapper is worthless and perhaps even dangerous. Because neither I nor anyone appearing on this program is trained in medical science, no statements or beliefs should be construed as medical advice. Consult your licensed medical practitioner for that. Much of the information presented on this program has not been scientifically proven and is theoretical, although it is believed to be true. Many, if not most, mainstream medical professionals will not agree with the views expressed. No claim is made on this program of any cure, and the guest is not a medical professional. Pregnant women and people wearing a pacemaker must never use the experimental electrical system used in the demonstrations on this program. Whatever data you receive is theoretical and is offered for informational purposes only. The theories result from personal research. You're also advised not to use any device you see on this program without expert assistance, and to take precautions against electrical shock or damage to your body. In some cases, death could result from the use of the electrical experimental device seen on this program or the failure to follow these guidelines. You must assume all risk if you use this information. Dr. Hulda Clark claims the zapper is effective in killing blood-borne bacteria, parasites, fungi, and viruses when it introduces microcurrent throughout the body. And according to her, it does no damage to human tissue or bacterial flora in the body. Also, the zapper does not work in gaseous cavities such as under the teeth, nasal passages, and lungs. It is also, she concedes, not effective inside the stomach and intestines. She recommends herbal and vitamin supplements to clean out those areas. There are also precautions. It is recommended that a zapper should not be used for the first time during an acute illness without cleansing the kidneys and liver. Failure to do so can make one even more ill. While not disputing the rare possibility of death occurring under extreme circumstances, and reinforcing the warning that pregnant women and people wearing a pacemaker must never use the zapper, Dr. Clark did express some concern about the severity of my disclaimer warning and the context in which it is made. She told me that, quote, the zapper's total electrical output is limited to the total output potential of its power source, a common 9-volt household battery. This common household and office item is used to power children's toys, electronic meters, travel clocks, etc. The 9-volt battery package cautions electrical injury, but warn only of the dangers if recharged or thrown into a fire. Manufacturers don't even warn against touching both terminals at the same time. There are many uses of electrical equipment, she said, operating at very much higher voltages, common in our society, which can cause an electrical current or field to be passed through the human body with little or no effect. Massive amounts of scientific literature in not only the U.S. but around the world show the results of tested electrical medical devices or devices used in society that could contact the human body. She concludes electrical devices are common in our society, end of quote. Notwithstanding the safety features of the zapper, one critic is still not satisfied that it does any good. Quote, the fact that these devices give off a beep or cause a light to go on or whatever is supposed to convince us that the little contraption has curative powers? It is one thing to apply electrical current to a clump of cells in a petri dish, as the scientists at Albert Einstein College did. It is quite another thing to suggest that applying the electricity of a pin-light battery to your wrists affects the structure of every cell in your body. This is silliness, end quote. Hulda Clark concedes that it does not work inside the body's cells, nor does it harm them.
The zapper can kill viruses too, but it doesn't reach into the chromosomes. It is an electrical device. It doesn't detect or measure. It just puts out a pulse of a certain frequency. The frequency is not very important. This one is set lower than the one that I usually use. Mine is usually 30,000 hertz cycles per second, 30K. This one might be somewhat lower, but it doesn't matter very much. You hold these two handles and you turn it on. This isn't one of our varieties. There are quite a few zapper makers now, and you can get a variety of zappers. You sit there holding it for about 7 minutes. On our model, a 9 might be even better. Then you give yourself a rest for about 20 minutes, because what's happening is that lots of viruses are coming out of the parasites and bacteria, I don't know which, that you killed. I don't know if the virus is coming from the bacteria or the parasites. But we get a flood coming out after the first zap. Then you do a second zap of another 7 minutes or 9 minutes.
I have a benign tumor. I was worried. I found a lump in my breast, a woman would say. I had a biopsy, We found out that it was not malignant. Should I be celebrating?
Yes, because it hasn't progressed to the point of malignancy. But you shouldn't be celebrating very hard very long, because you are at great risk for developing a malignancy in it. This parasite, Fasciolopsis buskii stages, will invade such a benign tumor. And after it gets going for a while, the tumor becomes malignant. The benign tumor is a much more complicated thing than the malignancy, and I worked for 5 years now working out what causes the benign tumor. It's a whole different thing. It's really mostly due to a bacterium, and so I call it the tumor-forming bacterium, Clostridium. It's a family of bacteria called Clostridium. See, there are about a dozen causes. You don't just kill this fluke parasite and other parasites. There are other additional causes. There is fungus growth there, bacterial growth, and oncoviruses are growing there too. And we have to kill them all. And when we do that and remove the major toxins, there are about 3, that's all. Altogether, a dozen isn't really that very much. And if we remove all that, the tumor shrinks.
And have you worked with anyone who you said, Tony, if you want to get rid of that cancer, these are the 5 things that I want you to do. And if you do these 5 things, I believe that the cancer malignancy will go away. Well, I do 3 of them. I don't do all 5 of them. So then my cancer doesn't go away. And then can I legitimately say to you, your treatment really doesn't work?
No, you can't legitimately do that. The body does appreciate your help very much. If you're in an early stage of cancer and you're still pretty healthy and you do half the things that I say you need to do, very often the body just takes hold and devours that whole tumor.
The question you must answer is, our Hulda Clark synchrometer device for diagnosis of pollutants and toxins and her zapper with its microcurrent tools for fools or self-health. In short, is it genius or quackery? The term quack, Q-U-A-C-K, is derived from the German word Quacksilber, Q-U-A-K, that was used to describe European dentists who in the 1840s used the new cheap poisonous mercury fillings. Today, dentists routinely use mercury. Quack today, however, is a term reserved not only for the quick buck criminal element, but for the medically trained who have strayed too far from the conventional medical practices. According to Dr. James Carter in his book, Racketeering in Medicine, The Suppression of Alternatives, more than 40,000 American physicians are tracked and in some cases persecuted for using unproven therapies. That means Hulda Clark type stuff. Allegedly, this could lead to state medical boards rescinding their licenses. This might also be a good time to mention that the 8th cause of death in the United States is caused by those trained in conventional medical practices, and that a recent opinion poll showed that 94% of New Yorkers want easy and full access to information about their doctors. In New York, 7,000 patients die each year because of medical errors. In these cases, you might say doctors buried their mistakes. Notwithstanding that fact, most doctors are good doctors. And there is some dramatic progress in the health trends. Cancer rates and death rates, for example, dropped between 1990 and 1997, reversing a trend of rising rates mainly because of a decline in cigarette smoking and dramatic drops in lung cancer among men. Blacks continue to have the highest rates in lung, colorectal, and prostate cancers. And while the biggest declines in cancer rates have been among men with prostate cancer, black men continue to have the highest rates of prostate cancer. Perhaps black men are not curbing their smoking habits. However, perverse benefit has accrued to black men because of a spate of announcements that increasingly famous white men are being diagnosed with prostate cancer, and more attention is being focused on it. But even for famous white men, conventional treatment for prostate cancer is anything but a walk in the park. Dennis Dugan, a Newsday columnist, described the surgery as a, quote, near-death experience that he rejected. There is something, he says, many doctors rarely tell the patient, that the surgery doesn't always remove the cancer, and if it does, there is the possibility it can reoccur. The surgical and radiation treatments are now more effective, but they still carry a significant risk of sexual impotence and uncontrollable urination, which result from nerve damage to the urethra. Most men choose surgery provided the cancer has not escaped the prostate. Nearly every man shows evidence of prostate cancer if he lives long enough, U.S. News and World Report reported in a special edition. The good news is, if you can call it that, autopsies show that 80% of men in their 80s probably have some cancer cells when they die, but these cells have never caused any harm. Hulda Clark believes that anything with nickel in it is contributing to prostate cancer. She believes that we rid our bodies of this element by not using knives, forks, and spoons made of nickel. Stainless steel is 8% nickel. She recommends plastic ware. Another source, she says, is metal dental ware or mercury fillings in our teeth, bridges, gold crowns, retainers. The trick to treating prostate disease is lowering the total body nickel levels, according to Hulda Clark. Bacteria cannot live in the prostate without nickel being present. She believes that you can cure prostate problems with the simple tactic of stopping nickel pollution of the body. To do this, she recommends the Zapper's electrotherapy, a kidney cleanse with herbs, and a dental cleanup by a dentist with experience of how to avoid overloading the body with the poisons that are trapped under the rotten metal in the mouth. Nickel draws cancer to the prostate. Another toxic in lipstick draws cancer to the breast. Still another pollutant draws cancer to the brain, and so on. Carcinogens, she believes, instead of causing cancer, draws the cancer to the organ. The worst toxins, in addition to nickel, are from your refrigerator, copper from water pipes, fiberglass or asbestos, mercury in tooth fillings, lead in the... Oh, by the way, Hulda Clark says that male pattern baldness is an allergy caused by nickel in the body. On a lighter note, her theory gives a new meaning to get the lead out. Although it is not cancer-related, a new study by researchers at Stanford University show a significant association between people exposed to bug sprays and other pesticides in their homes and the risk of developing Parkinson's disease, an incurable and fatal deterioration of the brain. Nickel, according to your book, is often found in the prostate of a male.
Yes.
Nickel comes primarily from soil.
No, although there's plenty of nickel in the soil, nickel comes primarily from your watch band, your metal glasses frames, and most of all, from metal tooth fillings.
Now, it also favors a particular kind of parasite.
If it's going to be hypertrophy leading to tumor formation and cancer, then it's always fasciolopsis. But fasciola stages get there, schistosome stages get there, Clinorca stages get there, which are other flukes.
And if it is colostrum, it could be from, according to your theory, leakage in the mouth, metalware, the metal in your teeth.
And of course, that isn't pure. There's nickel in every other metal, including the magnetic elements.
You admit you made one mistake, and that is, in your first book, you recommended that people do what?
Change their metal to plastic. I recommended changing it to composite, some kind of plastic, and now I do not.
And why do you now do not?
Because the plastic is so contaminated. And again, there is no purity in the minds of the manufacturers. That would be way too expensive, no doubt. But I didn't know that nearly every plastic has acrylic acid in it, and acrylic acid gets detoxified by the body to malonic acid, which leads to methylmalonate, and there you have your kidney disease. I didn't know that there were azo dyes in the plastic. That little bit of color that you see, azo dyes are in there.
You didn't think they would come from a white substance?
Right. I didn't suspect it. And I didn't know that there were magnetic elements as a pollutant in them. And I didn't know there was uranium in most of them. Uranium. Why? How could you be sucking on uranium all day, even if the radiation level is low, and not expect to develop tumors wherever that lands? At first, maybe you'll excrete it, but nobody in their right mind would be putting uranium in their mouths, not even putting it on their skins, and it is in our teeth.
If you had a gold tooth on this side of your mouth and a silver tooth on this side of your mouth, what would your mouth become?
You can expect current to run between those two because they're dissimilar metals.
Be like a battery, wouldn't it?
Yes.
Like an electric battery.
Yes.
Why do you so strongly recommend that we get the metal wear out of our mouths?
In every case of baldness, I have seen nickel in the scalp. People who are not getting bald don't have nickel in the scalp. So I think there's a likely cause there. There's a very big contribution of metal, toxic metal, to cancer, tumor growth. I see copper, cobalt, vanadium always there. I see germanium, toxic germanium always there. And many contributors. If it's prostate cancer, you see nickel. If you see ovarian cancer or cancer of the pancreas, you see gold. We thought gold was so good. Not at all. It has a place where it likes to accumulate.
One of the leading causes of death in America is kidney disease. Your kidneys are vital organs that perform several life-sustaining functions. They cleanse the blood of waste products, toxins, and excess water, and they keep the chemicals in the blood properly balanced. In fact, your kidneys process about 200 quarts of blood, filtering about 2 quarts of waste products and extra water every day. In addition to removing waste, your kidneys release 3 important hormones which stimulate the bones to make red blood cells, regulate blood pressure, and help maintain calcium for bones and for normal chemical balance in the body. Acute renal failure and chronic renal failure are terms used to describe a loss of kidney function. Diabetes and high blood pressure are the 2 leading causes of kidney failure. Other causes of kidney disease are hereditary factors, poisons, and physical trauma. According to the National Center for Health Statistics, kidney disease was the 9th leading cause of death in 1997. What parasitic name would you give kidney disease?
I don't know a parasite for that, but the toxin is methylmalonic acid. Methylmalonate is the toxin. That derives from plastic. There is also, I think, an endogenous source that I haven't studied enough yet, but plastic in your teeth is what makes methylmalonate.
The largest organ in the human body is the liver, which plays a vital role in regulating life processes. It converts food into chemicals necessary for life and growth. It manufactures and exports important substances used by the rest of the body. It processes drugs absorbed from the digestive tract into forms that are easier for the body to use. And it detoxifies and excretes substances that would otherwise be poisonous. 25 million Americans, 1 in every 10, are or have been afflicted with liver, bile duct, or gallbladder diseases. It is estimated that 26,000 Americans die each year from chronic liver diseases and cirrhosis. There are an estimated 3.9 million people chronically infected with hepatitis C. 1 out of every 250 persons is a carrier of the highly infectious hepatitis B. Asians and Pacific Islanders have the highest rate for hepatitis B infection. Non-Hispanic blacks have the highest infection rate for hepatitis C.
All kinds of liver disease is just a whole big collection of parasites in the liver. And the liver has lost its immunity. That's why you're getting hepatitis C and other liver diseases. By loss of immunity, I mean the same 2 things I mentioned before. Asbestos eating has caused coating of the white blood cells with ferritin. And the other immune-lowering cause is magnetic metals. When you eat magnetic metals like thulium, gadolinium, lanthanum, erbium, terbium, 15 of them, magnetic metals, they ruin your white cell's ability to move around. The white cell has to be able to see its enemy, and it has to be able to move around with great mobility to get its pseudopods out there to grab the enemy. Those are the 2 main functions. And when you knock that out with asbestos eating and knock it out with lanthanide eating, the magnetic metals, you have a loss of immunity, and that organ will fail.
Another leading health condition that kills thousands in this country is blood poisoning. Sepsis, also called septicemia, is the invasion of bacteria into the bloodstream, usually from trauma to the body or disease. The bacteria that cause the infection and the endotoxins released by the body's immune system to fight it interferes with the flow of blood to the body tissue, causing symptoms of fever and chills. Each year, roughly 500,000 Americans come down with sepsis, Some statistics indicate that from a third to one-half of these patients die from the disease despite huge doses of antibiotics. In 1996, this disease was the 10th leading cause of death among black women. Blood poisoning.
I think it would mean some toxic, some bug that is systemic gone through your whole system and would be so toxic as to kill you, poison you, in other words.
Alzheimer's disease is a progressive degenerative disorder that affects the brain, leading to the loss of mental and physical functions. It is the most common form of dementia that occurs in the elderly. This disease, or a related dementia, afflicts about 3 to 4 million Americans, 5% of the people over 65 years of age, and 20% of those over 80. It is reported that at least half of the people in the nation's nursing homes have this disease or a related disorder. The Alzheimer's patient will eventually die from this disease within 8 years, although some may live with it for up to 20 years. Alzheimer's disease.
Yes.
And the parasite, is that flukes?
Fasciolopsis flukes.
Now, Fasciolopsis buski is what kind of fluke? Is a fluke?
It's a fluke, yes, meaning a flatworm. It's a leech. It's a tiny leech.
And what pollutant is that with?
Xylene and toluene, two solvents that are getting more and more prevalent in our food and beverages, processed food.
According to the National Institute of Allergy and Infectious Diseases, an estimated 33.4 million people worldwide with HIV/AIDS by the end of 1998. And the CDC reported 688,200 cases of AIDS in the United States. The cumulative HIV/AIDS-related deaths worldwide by the end of 1998 hit 13.9 million. Over the years, we have presented programs debating whether HIV is the true cause of AIDS. Renowned virologist Dr. Peter Duesberg says that the so-called AIDS epidemic in Africa is actually caused by malnutrition and parasitic infections. There are 28,000 Americans dying a year of this. Now, we are told that there's just no way we can cure AIDS, but you're saying that you can.
We could do it very quickly. We need to take the benzene out of our food supply and product supply, and probably for Africa, I think it's in their water supply.
Tony Brown Productions produces this program and is solely responsible for its content.